Hey guys, let's have a quick chat about exercise for people with multiple sclerosis now. So I'm going to go ahead and share the screen with you per usual. And we will just keep rocking and rolling through it. So let's talk about multiple sclerosis. So according to the National Multiple Sclerosis Society, 400,000 Americans and 2.5 million people worldwide have been diagnosed with MS. I'll refer to multiple sclerosis as MS from here moving forward because it's a lot easier to say, for one. A lot of times the symptoms of MS do go unnoticed, and early in its progression especially, you can attribute some of the symptoms that you're seeing to other things. You can make excuses. Oh, I just didn't get much sleep last night, things like that. A lot of people who actually have MS haven't been formally diagnosed, especially if they're in the early stages. So those numbers are close, but not exact by any means. Initial symptoms, need to know this, are blurred or double vision, or red-green color distortion, which is an odd thing, but very specific, so you need to know that. Some other difficulties that come with multiple sclerosis are lack of balance, incoordination, fatigue, just general fatigue, general muscle weakness, speech disturbances, and memory problems as well. Usually with MS, diagnosis comes between the ages of 20 and 50. It's not normally fatal. 2/3 of MS sufferers stay relatively mobile, and they're able to perform their activities of daily living. Something else to make note of is that MS affects twice as many women as it does men. It's a progressive disorder, and obviously it affects not only just the people who are afflicted with MS, but also the ones that are around them, their family, friends, the ones that they are dealing with on a daily basis, because it is progressive in nature. So as far as characteristics, it's autoimmune disorder. It destroys the myelin sheath of the central nervous system. And what that is, it has to do with nerve impulses from the body. Our central nervous system says, let's do this. And the more insulation, let's say, that's kind of what myelin sheath is on the pathway to keep things going where they're supposed to go, to keep from there being interruption, the better you're going to perform. When that myelin sheath is destroyed, then some of the information doesn't get to where it needs to get to. It's a progressive disease. Demyelination, where the myelin sheath is destroyed, occurs during phases of relapse. Remyelination, which is when there actually is some recovery, attempts to repair damaged myelin. Inflammation is going to accompany the stage of remyelination. Plaque formation can follow repeated bouts of demyelination, remyelination, and inflammation. So plaque formation is a negative situation, kind of like scar tissue, just in a smaller scale. And from this process, your axons eventually deteriorate. And axons also have to do with the propagation of impulses in the body. Hey, my hand's on a hot stove, let me lift it off. That helps with that thought moving to action. So as far as changes anatomically and physiologically that come along with MS, this remyelination that we talked about on the previous slide, it occurs in some MS sufferers, but not in others. And researchers don't really understand why that it occurs in some but not all. These demyelinated axons often die, so you're losing the ability to propagate signals when that happens. Researchers believe that the progressive nature of MS likely results from this cumulative loss of axons. The more, as you start having the remyelination, demyelination, then you start having plaque buildup and the axons start to die. The more and more axons that die, that makes the nature of MS become progressive. Researchers also continue to investigate methods to stimulate remyelination in an attempt to slow the progression of the disease and preserve axon function. It's just a fight against keeping, against letting MS continue to progress is what the fight is, to keep someone where they are by remyelinating axons and repairing that myelin sheath that we talked about. We named some of these symptoms already, but symptoms of MS: physical, mental fatigue, visual disturbances, and we talked about specifically what visual changes you see, especially early. Muscle spasticity with or without pain, that's tightness in the muscles. Loss of balance and coordination, urinary incontinence, depression, and mood swings are also common, and unexplained anxiety, just feeling anxious and don't really know why. As far as risk factors for developing MS, we said before, sex, it affects 2 to 3 times more women than it does men. Whites are 2 times more likely to develop MS than blacks are. MS typically occurs in people between the ages of 20 and 50. Rarely happens to those younger than 15 or older than 60. It's more prevalent in temperate regions than in tropical regions. So areas where you have a lot of seasons, or temperate regions, you get really cold and really hot. Whereas in tropical regions, it's more of a hot most of the time type of situation. Genetically, they think that some people are predisposed to react to environmental triggers in a way that promotes MS development. Not necessarily that it's handed down from a parent or anything, but you may be genetically predisposed to developing MS. As far as diet, it's been shown that countries that consume a large amount of saturated fat have higher incidences of MS than those that have smaller quantities. And there's other viral infections that trigger demyelination and inflammation in the people that are genetically predisposed already. And this is, as it says, a major focus of current research. So, factors that can contribute to the development of MS. And a lot of this stuff, it kind of circles back around and talks about the same things on different slides, and that's not a bad thing. It will help you remember some of this information. Some experts believe that MS is caused by an unknown environmental trigger, such as a virus, perhaps. Since it's more common in temperate areas rather than tropical areas, researchers are looking to try to figure out what that link might be. The inhabitants in sunny regions are continually exposed to ultraviolet radiation and make larger amounts of vitamin D than people that are in less sunny regions. So that's something to be researched and looked into. Maybe the ultraviolet radiation and vitamin D play a role in helping people not to become affected as much. Some experts think that MS might develop more readily in people born with a genetic predisposition. We already talked about that, but most likely it's a combination of genes acting together which predisposes individuals to MS. So there are 4 categories we'll talk about, and for this portion, you need to know about each one. You need to know kind of the symptoms. You need to be able to differentiate between these and pick them out as far as the test will go. The first is relapsing remitting, primary progressive, secondary progressive, and then finally progressive relapsing MS. Those are the 4 types, and we'll talk about those. In relapsing remitting, it's the most common form upon initial diagnosis. In this case, the individuals experience periods of acute flare-ups where neurological functioning is deteriorated as the body's immune cells are destroying myelin. We're talking about the myelin sheath being affected. There's going to be inflammation and lesions, and the relapse can last from a few days to a few months and followed by a period of actual remission where symptoms may completely disappear when the inflammation goes down and remyelination is occurring. Remission can be almost instantaneous, or it can be slow and gradual. Primary progressive is a relatively rare form. It usually develops in late 30s to early 40s. Sufferers of primary progressive MS, they're going to experience a steady decline. They won't have any relapses. They won't have any remissions. It's just an actual steady decline from the point of development. The actual rate of deterioration is going to vary from person to person, and improvements in people who have primary progressive MS are infrequent and minor. It's very difficult, and it's difficult to watch because it is just deterioration that is showing a steady decline in motor ability. Secondary progressive MS, it traditionally occurs in 50% of those diagnosed with relapse remitting MS. Basically what happens within about 10 years of being initially diagnosed with the relapsing remitting MS, where you're going to see some times of remission, it turns to secondary progressive. So after several years of this, sufferers begin to experience a slow but steady worsening of the symptoms with or without flare-ups. The disease progresses in between relapses until relapses essentially merge into just that continual progression of disease, and you're not really seeing any respites, any remissions at that point. Progressive relapsing MS is the rarest form. Essentially primary progressive MS with periods of relapse and remission in between is what we're looking at. Unlike relapsing and remitting form, this form is marked by progressive deterioration. So they do have some relapse and remission thrown in at different times, but it's basically like the primary progressive, where you have the slow decline or fast decline depending on the individual. As far as treatment, there's not currently a cure for MS. There's some medications out there that have been shown to be promising on slowing progression once the diagnosis has been made. Diagnosis isn't really easy for MS because a lot of the symptoms, they're variable. They resemble other conditions like spinal cord tumors, stroke, Lyme disease, syphilis, diabetes, herpes, migraines even. There's tons of different things that people can attribute what's going on to other than thinking, oh, I have MS. The only way to really find out whether a patient has MS is to rule out all of these other conditions that I was just talking about before they're able to settle on a diagnosis of MS. Another thing that makes it difficult as far as treatment and diagnosis is that the symptoms sometimes tend to come and go, which makes it very difficult to pinpoint what's triggering the phases that are happening and the times that you have a lot of symptoms when sometimes you don't. So since there's not just one diagnostic test, they can't draw your blood and look for MS gene. There's a battery of tests that must be done, and it includes a full medical history, neurological exam. They'll do a spinal tap. They can look at your body through an MRI, magnetic resonance imaging. Blood tests can be done. What they're doing through all of these tests is screening out all the other available options of what could be going on with the patient. So basically, as far as treatment, it just involves managing the current symptoms and trying to slow down progression. And some of the ways that the symptoms are managed are through using physical therapy, occupational therapy, exercise, as well as certain dietary guidelines. There's some drugs out there, like I said, that do help to alleviate some of the MS symptoms. The problem is that a lot of the medications cause side effects like hypertension, osteoporosis, and weakness. With almost every medication, there's the benefits, and then there's the disadvantages. You get side effects and things with most drugs, some sort of side effect. These drugs are going to include things like corticosteroids, muscle relaxants can help with the spasticity, stimulants, beta interferons, and glatiramer acetate. Not going to test you on that because I don't even know what that one is myself. As far as precautions during exercise, we have to watch out for the fact that they have a lot of fatigue. In a lot of cases, it's debilitating. This muscle spasticity, we're talking about very tight muscles. So it's these top two things are going to make exercise very difficult during a specific flare, especially. You also have to watch out for muscle weakness, poor balance, and incoordination. Another thing is that people with MS show a lot of sensitivity to heat. There's pain involved in some cases. And we talked about how sometimes incontinence can be, a problem as well. Inability to hold the bladder. Put a big star by this. The most common symptom associated with MS is fatigue. It's not spasticity, it's fatigue. Fatigue can range from just a general lack of energy to total physical and mental exhaustion. And in a lot of the cases, fatigue is going to show up suddenly and severely with no real reason that can be found for it. And other times, it only comes from prolonged exertion or overheating, when they overdo it. There's two types: fatigability that occurs within a specific muscle group or group of muscles after continued use. So that's kind of in the realm of what we just spoke about, where it comes from prolonged exertion, overheating, etc. And then there's lassitude, which is just a persistent feeling of exhaustion that doesn't subside even after you rest. Know the difference between those two things. Muscle spasticity, it occurs in the lower extremities. So you could think if your muscles are really tight in your lower extremities, it can be dangerous during exercise. Many of the patients take muscle relaxants to manage this spasticity, and the medications can also interfere with exercise ability, not just the spasticity in the extremities. Flexibility training tends to reduce the severity and the frequency of spasticity. I used to work doing aquatic therapy at the regional center here in town, and I would see a great deal of benefit with working with our clients in the warm water, and have them in the warm water with no stress on them whatsoever. And I would do some light stretching and things while they were in the water, and I would see a good bit of improvement as far as spasticity. It would even last another, a day or so afterwards at times. So it can be reduced. As far as muscle weakness, balance issues, and incoordination, there's a couple reasons for this. Number one, a lot of people who have MS, once they get the diagnosis, they become inactive because some physicians are going to discourage exertion because, as we said, it can lead to increased symptomology. So you'll see people start to avoid stairs and take elevators. They'll park closer to a store instead of far away. They won't walk any longer than they just have to. This is actually the opposite of general recommendations for people with MS. And it'll tend to result in overall weakness and imbalance that could be fought off to a degree if they still made it a point to take the stairs and park a little farther out. Another reason for muscle weakness and balance issues and incoordination is the destruction of the myelin sheath and axons that we talked about early on in the talk. Exercise can't improve the loss in functional ability that's associated with demyelination, but it can preserve and improve muscle function in the areas that are unaffected. And that what that can do is help to pick up for the areas that are affected and help to do the job that those areas would be doing. If you strengthen other muscles, they can carry more than they would prior. So it's just a good thing to do to try to preserve and improve this muscle function. As far as sensitivity to heat, and more than 80% of MS sufferers, when they have an increased core body temperature, their symptoms are going to become worse. And the main reason for this is that the high temperature seems to interfere with that impulse propagation we've talked about, going along those demyelinated axons, the ones that the myelin sheath has been affected and broken down. So the important thing with exercise here is that we have to keep exercise intensity low enough to avoid this overheating. So in order to do that, we want to exercise in a cool environment. We want to do that either in the water or an air-conditioned room. The water is a great environment because it'll keep them cool, and it also takes a lot of the pressure off. It helps with balance because of buoyancy and hydrostatic pressure and all. So it's a really good plan to use water as a therapeutic environment if possible. Pain and incontinence. Pain levels are going to vary on a daily basis, basically, for people who are suffering from MS. As it progresses, as they start to see problems with the urinary system develop eventually, and you run into a problem at this point. It's the same thing happened with the elderly, if you recall. When people start to have incontinence, they're starting to have trouble holding it when they have to pee, then they start restricting water intake. And that's a no-no, especially with people with MS, because overheating has been shown to make symptoms worse, and that's exactly what we don't want to happen. Some barriers to exercise: they fear that they're going to worsen their symptoms. That's the number one barrier. They are afraid of promoting disease progression or making it worse. Another primary barrier: this general lack of energy. When you don't have energy, you're very fatigued. Do you feel like exercising? No, not at all. Also, there's this unpredictability of relapse. When's it going to happen? Am I going to get out today and then have a relapse? So they're scared to get out and do things. And that plays into the next one, where it says that they show a decrease in self-confidence. Relapse makes it where it's difficult to do things, and it's hard to do things that you've once done. So that plays into things as well. There's also, and that's why this next one is something I want y'all to make note of, and kind of why I teach the class the way that I do, is I want you to know about these specific populations, as much as I don't talk as much about what exercises we should do with each one. You need to understand disease-specific knowledge for each one of these special populations that we're talking about. And a lot of fitness centers don't have individuals working there who know anything about MS. So that's the first problem. You know, they wouldn't know that they don't need their clients to overheat. They don't know that they have trouble with balance. So you start giving them the wrong information and the wrong exercises, and before you know it, you've got somebody hurt and a liability issue on yourself from not knowing what is going on with, you know, these specific populations we've talked about. Another barrier to exercise that is seen is that individuals, they have that fear of falling because they know that they have some balance problems. You know, once they fall once or twice or nearly fall, that becomes a area of fear for them. So benefits of exercise. As recently as 20 years ago, physicians would basically across the board tell people who had MS not to do any physical activity because they thought that exertion is going to worsen their fatigue and possibly even encourage more symptom development. Now, we talked about how that can happen if you overdo it and you get overheated, but they don't need to be refraining from all physical activity. Absolutely not. That's not good for anybody. But over the years, researchers, they've shown that people with MS can not only tolerate exercise well without making their symptoms worse, but they get benefits from it. They're going to see reduced risk for chronic diseases like heart disease, cancer, stroke, and diabetes. They'll have a reduced perception of fatigue. There's some conflicting results when it comes to this, though, where some researchers found exercise actually decreases the perception of fatigue, but most have discovered exercise resulted in little or no change in fatigue levels. If it doesn't make fatigue worse, then you would be better off to participate in exercise and get reduced risk for the chronic diseases that are listed above. Also, you'll see improvements in muscular strength, muscular endurance, flexibility, and balance, all very positive for this special population, and improved mood and confidence, which we've seen with every group we've talked about so far. There's no real standard exercise testing guidelines for people with MS. They just need to obtain medical clearance before initiating exercise testing or exercise programs. The capabilities of people with MS, each individual is going to vary considerably even from day to day. So physicians, if there's going to be testing done as far as exercise testing, physicians should probably be involved with this. Professionals working with this group, they need some post-rehabilitative specialty training because MS is so variable. We talked about how there's 4 different types and how there's different levels of each type, you know, as far as where you are on the continuum of how much you're being affected. So if you're going to be specifically working a lot with this group, with a group of people who have MS, then there should be some specialty training involved. As far as exercise guidelines, duration, frequency, and intensity are going to be very, very much variable, like we talked about, because of the variance of symptomology and things like that comes along with MS. So you want to choose activities that the client enjoys, that they can execute with neutral alignment, jogging, cycling, rowing, walking, but keeping in mind not to let them overheat while doing these things. Talked about how water is a good medium to work in. Probably want to consider water aerobics or swimming because water cools the body, minimizes that overheating risk. Tai Chi and yoga are also really good. They help a lot with balance. They help with muscle tone, flexibility, And you see that because you're using slow, deliberate movements. It gives them time to adjust to where their body is. Encourage frequent rest periods. Stay away from slippery floors because of the balance issues, and make sure that there's adequate lighting, and mark equipment clearly. We talked about how there's some vision issues as well. So if you've got a step, you might need to make sure that it's marked with the bright yellow tape or something. You don't want them tripping because they don't see what's going on. And you don't want to have a workout area that's cluttered with things that they could trip on and fall either. That's kind of common sense information there, though. As far as nutrition, there's very little research that's been done on the research between MS and diet. Diet doesn't appear to cause, prevent, or slow development, though. But some of the research shows that certain nutrients like dietary fats, antioxidants, vitamin B12, and vitamin D can possibly improve MS symptoms. So researchers started looking at the progression between dietary fat intake and MS progression, because fat is the major component of the myelin sheath that is being broken down. That's the part of the neuron that's attacked by the immune system in MS. So, if the sheath is made of fat, what's the relationship between dietary fat intake and the progression of this breakdown of the myelin fat sheath? Something else, we talk about how different geographical areas have different prevalence. Because MS is more common in geographical areas with limited exposure to sunlight, some have suggested a link between vitamin D deficiency and MS, and they think that vitamin D supplements might slow disease progression in people that are suffering from this deficiency. There's not really enough research yet to support this or not, but it's a pathway that's being researched at this point. There's some other organizations suggesting that dietary restrictions of gluten, sugar, pectin, processed foods, when you restrict those things, it can slow the progression of MS, but there's not really any data to support that. But these are just some things that are being looked at in regards to progression of MS. So as far as nutrition, people with MS benefit from a well-balanced diet, just like you and I. They usually report they feel better when they eat healthy foods that comply with the basic dietary guidelines, and there's a link to the pyramid here. As long as their diets are varied, provide adequate energy, people with MS don't normally even need any special supplements unless their diet is lacking in certain nutritional areas. And here's the summary. Again, you go back and read this. One thing that sticks out on here, though, is people with MS don't need to avoid physical activity for fear of worsening their symptoms. That was once the case where doctors told them not to. That has changed. They need to participate in some physical activity to slow down this deterioration. So thank you, guys. I appreciate y'all taking the time to watch this, and hope your semester is still going well. I will talk to you later.